I'm Eric Beights. I'm a foot and ankle surgical specialist, and I'm a 7th year associate at Seaview Orthopaedics. A very common problem that I see in the office is heel pain. Heel pain can come in multiple different varieties and for multiple different reasons. I think it can be a little bit oversimplified in some people's minds, but there are a lot of different reasons why people can develop heel pain. A few of the most common ones would be Achilles tendon insertional pain. The Achilles tendon comes right down and inserts on the back of the heel, and this bit of bone back here can rub on the Achilles tendon and cause irritation and bursitis. That can be a really challenging thing to treat, but it's important to distinguish that from heel pain on the posterior or the bottom part of the heel. More commonly, we see plantar fasciitis arise from the bottom of the heel. This is essentially irritation of a long ligament that attaches the heel to the toes. It gets thick and irritated and can be very debilitatingly painful. Additionally, sometimes the fat pad that separates the heel from the bottom of the ground can become very thin, and essentially you're walking on the bone with no padding in that particular case. Another thing that can be really problematic is irritation of one of the nerves that comes from back behind the ankle and then innervates either the bottom of the heel or the fat pad just beneath the heel. A lot of these things can happen all at the same time as well, so it can be really challenging to unpack everything that the patient is describing as a painful area and what exactly to do for it, as each one of these things has a different type of treatment that's effective. If you're dealing with plantar fasciitis, most of the time this is a self-limiting problem. It will go away if you use the right shoes that are stiff and supportive through the insole, if you spend some time stretching and icing and taking a break from the activity that's causing that pain. If that does not cause relief of symptoms, a lot of times therapy can be really helpful. Massage therapy, shock wave, all kinds of modalities that they can do in physical therapy. And then ultimately, sometimes you do require an injection for the heel, and that can be very effective. If all of that fails, sometimes we resort to more experimental treatments for heel pain, such as stem cell injections or even radiofrequency ablation, which I've found to be very effective for that condition. For the back of the heel, you have to avoid steroids. Steroids can actually cause tearing of the Achilles tendon, and typically we either avoid this or do it very, very sparingly. For the back of the heel, typically I recommend things like ice massage, using a slight heel lift to decrease the tension on the Achilles tendon, or using techniques like topical anti-inflammatories to decrease swelling and pain on the back of the heel. If that condition doesn't get better, sometimes a period of immobilization and even surgery to clean up the tendon and the bone that can be rubbing against the back of the heel can be necessary. If the nerve is entrapped in this area of the foot, sometimes it needs to be released surgically or injected with a steroid. Heel pain can be something that comes and goes. As long as it comes and goes very quickly and does not interfere with your daily life, you can treat that on your own. If it's something that is simply not going away in a reasonable period of time and it's affecting your ability to work or to recreate, you should really see somebody, because it could be a number of different things that are going on, and you don't want it to get too far down the line before you treat it appropriately. My #1 prevention for heel pain is to wear good, stable, supportive shoes. Most shoes out there bend in all the wrong ways and are not supportive for an active person or even, frankly, a sedentary person. I recommend getting a good, stable, supportive shoe that's actually designed to support a foot. There are a number of different brands that fit this description. Typically, my rule of thumb is to go and find a shoe that you'll wear, test it for stability in the middle of the arch. If it bends easily, then that's going to place a lot of stress and strain on the plantar arch and on the heel. If it's stable through the middle of the arch, that's a more beneficial shoe for your foot and for prevention of heel pain. Another thing that you can do on a regular basis is to stretch. A lot of people come in with very, very tight Achilles tendons, and a very common way to get either heel pain on the back of the heel or the bottom is to have a very tight heel cord, and that can be stretched on a daily basis to help prevent that condition. Another thing that people overlook is actually foot strengthening exercises. People are strengthening their cores, their shoulders, their abs and biceps, but they forget about the small muscles that are inside the foot that can be really beneficial to help strengthen. And a couple of very simple exercises that seem silly at first are very beneficial, such as picking up marbles or pulling a towel towards you with your toes, or even just standing on one foot for balance as long as you can. People who do see me in the office know that I talk about these types of exercises all the time and get tired of me saying them, but they're very, very effective for this type of a condition. If you have heel pain that's not going away, you should really come in to see us. There are lots of things that we can identify pretty easily, either with an x-ray or an ultrasound right here in the office, that can really prevent this problem from getting out of hand. We can solve it in the early stages. If you come in a little later, sometimes it will require something more invasive.